projects we've made on colorectal cancer mortality and about the screening of that condition. And so colorectal cancer is in Europe the second cancer, I would say, and it affects both male and females. And in Europe, about 400,000 people are diagnosed with colorectal cancer every year. So it's quite a big burden of disease. And this busy slide shows you, in fact, on the decrease, what is the changes in the mortality from colorectal cancer in all the European countries, 31 countries, from 1989 to 2010. And what this slide shows that on the top level you have all bars going on the left side. These are the decreases, the countries where you have a sharp decreases in colorectal cancer mortality. Whereas on the bottom of these slides you have the bars going on the right, and on the right means that the colorectal cancer mortality is still on the increase. These are the European countries, so it shows that it goes the variability in trends in colorectal cancer mortality in all European countries, and these alludes to what my colleague Philippe had just showed before, the huge variability in cancer mortality across European countries, and we have the same for breast cancer and so on. But this shows how the diversity we have in Europe concerning mortality from cancer. We don't have that, for instance, in the United States. That's something quite unique in the world. So that's the huge variability in Europe. And this variability, if we focus on some countries with quite, say, relatively wealthy economy, we see there that there is quite a difference in the trends in mortality from colorectal cancer, starting on the upper left with Germany, where you have considerable decrease in colorectal cancer mortality since, say, 20 years, with minus 35% among males, minus 44% among women. And then as you go down from left to right and down to the slide, you see that at some point you have, even in the Netherlands, you see that the Netherlands, for instance, does not enjoy such a decrease in colorectal cancer mortality, not as much as Germany or France, for instance, or even Belgium. And then you have Greece, where in fact colorectal cancer mortality is still on the increase. Of course, we could ask ourselves why there is such a discrepancy, apart from socio-economic, economic wealth and things like that. Is there something else that could work? And here we come with the screening. And then on this slide, just to illustrate what screening is trying to do with colorectal cancer, and you have two types of screening basically. One is trying to catch the cancer when it erupts. The cancer is invading the intestine, the large bowel, and then you have some blood that is leaking in the stools, and that these are the fecal occult blood tests, searching for blood in the stools. And then you have on the left side of the slide, you have detecting polyps. Polyps are precursor lesions of colorectal cancer. So these polyps are not bleeding, but you can catch them with endoscopic techniques. You go with a lumina, and then you can catch them and you can remove them with endoscopic techniques. So basically that is the other endoscopic technique based screening for colorectal cancer. And just to say that in any case, whatever you do as a test for colorectal cancer, it ends up, when it's positive, suspicious, always in a colonoscopy. That's to say, a full examination of all the bowel with an endoscopic technique. And just to say that these screening tests have all been tested through randomized trials, just provide the best evidence for efficacy. And all these trials, 8 trials, have shown, done in Europe, done in the United States, have shown that screening for colorectal cancer is really able to decrease the mortality from colorectal cancer. Of course, we ask ourselves, do we find that across populations? And it's good to see, okay, in the trials, it's one thing, but do we find that evidence across population? And then we found for 11 countries in Europe comparable data on colorectal cancer screening, which is rare, because comparable data means that you got information from standard questionnaires with the same way to collect the data. And then, of course, we compare that with the mortality from colorectal cancer. And this is the main finding we have done. Again, sorry for this complicated slides, but just going through shortly just to say that what you have on x-axis is the percentage of adult people who are 50 plus who ever had an endoscopic examination. So it means that, for instance, if you take France, for instance, in France with FR, you have about 30% of adult people 50 plus who ever had a colonoscopy or a sigmoidoscopy, generally. That's what the point of France. And then on the y-axis, what you have the change in colorectal cancer mortality over the last 20 years. So that's, you have the change from, say, 89 up to 2010. And what we can obviously see on these graphs is that the higher the rate of having had an endoscopic examination, a screening, the greater the decrease in colorectal cancer mortality. You have it both for males and females. And again, when we look at some countries where I just showed before, for instance, you have the Netherlands, you have NL, Netherlands, where we have seen before a very small decrease in colorectal cancer mortality, but this is paralleled by a very low amount of endoscopic screening. Whereas when you take countries like France and also DE, which is Germany, in fact, you have quite a strong decrease in colorectal cancer that is correlated with a very high proportion of people who submitted to endoscopic screening. And just to say what about other screening like fecal occult blood tests, they work too. The fact is that here this graph we just plotted together those where had passed a fecal occult blood test with those who had endoscopy, and it's practically parallel. So both tests, all these tests are working, I would say. So I don't want to make any difference between the tests. I just want to underline that they're really effective within populations. And our conclusion is that really the cancer colorectal screening is really contributing to the decrease in colorectal cancer mortality, and it's probably working as well as for cervical cancer screening. So potentially it's a cancer for which we could make huge strides in decreasing the cancer mortality through screening, and would be much better to divert and to direct target resources we have towards the screening of such conditions like colorectal cancer, cervical cancer, and less resource to cancer screening where it's far more controversial, like the breast cancer or even more worse, the prostate cancer screening. Thank you very much.
Great, thank you very much.